breast cancer remains the most common cancer among women worldwide, and the situation is worsening at an alarming rate. A new study by the International Agency for Research on Cancer, IRC, in Lyon provides a sobering analysis of global breast cancer trends, highlighting a dramatic increase in cases and deaths expected by 2050. While medical advancements have improved treatment options, they have not been enough to counteract the rapid rise in diagnoses. The disease is no longer just a growing concern. It is a full-scale global health crisis that threatens millions of lives, with the worst yet to come. In 2022 alone, approximately 2.3 million women worldwide were diagnosed with breast cancer, and around 670,000 lost their lives to the disease. These numbers are staggering, yet they only hint at the extent of the crisis. Breast cancer now accounts for 25% of all new cancer cases among women and is responsible for 15.5% of all cancer-related female deaths. Despite public awareness campaigns and early detection efforts, too many cases are still caught too late, when treatment options become limited and survival rates plummet. The disparities in breast cancer rates across different regions highlight how unevenly the burden of this disease is distributed. Countries such as Australia and New Zealand report the highest incidence rates, with over 100 cases per 100,000 women, whereas regions like South Asia see significantly lower rates. However, lower diagnosis rates do not necessarily indicate a lower risk. Many cases simply go undetected due to lack of access to medical care. In places with poor healthcare infrastructure, breast cancer becomes a silent killer, claiming lives without even being formally diagnosed. Meanwhile, regions such as Melanesia record particularly high mortality rates, further emphasizing the devastating impact of inadequate healthcare access. Perhaps the most chilling statistic revealed in the study is that 1 in 20 women worldwide will be diagnosed with breast cancer in their lifetime. Equally disturbing is the finding that 1 in 70 women will die from the disease. In high-income countries, such as France and North America, the lifetime risk of developing breast cancer is significantly higher, affecting as many as 1 in 9 or 10 women. While advanced medical systems in these countries offer better survival rates, the sheer prevalence of the disease continues to put enormous strain on healthcare resources. In lower-income regions, the mortality risk is even more dire, as limited access to early detection and treatment leaves many women with little chance of survival. Looking ahead, the study paints an even grimmer picture. By 2050, annual breast cancer diagnoses are expected to rise by a staggering 38%, reaching an estimated 3.2 million new cases each year. Even more concerning is the projected increase in deaths. Experts warn that breast cancer fatalities could surge by 68%, exceeding 1.1 million deaths per year. If these predictions come true, breast cancer will not only continue to be a leading cause of cancer death, but could become an even greater public health catastrophe than it already is today. Despite these alarming trends, the study does not offer a detailed analysis of the root causes driving this surge in cases. However, researchers and medical professionals have long pointed to a combination of factors that contribute to rising breast cancer rates. Lifestyle changes, including increased alcohol consumption, obesity, and declining physical activity, have all been linked to higher breast cancer risk. Additionally, environmental factors such as exposure to endocrine-disrupting chemicals in food and personal care products are increasingly suspected of playing a role. The growing prevalence of hormone replacement therapy and later childbearing have also been associated with increased breast cancer risk. The reality is that modern society is creating conditions that are making breast cancer more common, and without significant changes, the situation will only deteriorate further. One of the few weapons available against this rising epidemic is early detection. Yet millions of women still do not undergo regular screenings. In countries with well-established healthcare systems, mammograms and self-examinations are strongly encouraged, but participation rates remain far from ideal. Many women avoid screenings due to fear, misinformation, or financial constraints, increasing the likelihood that their cancer will only be detected at an advanced stage. In low- and middle-income countries, access to routine breast cancer screening is even more limited, and the result is an overwhelming number of late-stage diagnoses. Without aggressive intervention to improve global screening rates, breast cancer deaths will continue to rise unchecked. The dire predictions laid out in this report serve as a call to action. Governments and healthcare organizations must prioritize breast cancer prevention, early detection, and research into new treatment methods. Funding for awareness campaigns must be increased, and efforts to reduce barriers to screening and treatment need to be intensified. More importantly, the global conversation around breast cancer needs to shift from passive concern to urgent action. Women must also take personal steps to protect themselves. Those over 30 should make routine breast cancer screenings a priority and stay informed about their individual risk factors. Lifestyle changes, such as maintaining a healthy weight, reducing alcohol intake, and engaging in regular physical activity, can also lower the risk of developing breast cancer. However, personal responsibility alone will not be enough to combat this crisis. Systemic change is required. If current trends continue, millions of women will face a future where breast cancer is not just a possibility, but an inevitability. The time to act is now, before breast cancer becomes an even more devastating global epidemic. The numbers make it clear, waiting is not an option.